Awesome. Okay, so we're going to do the neuro assessment. Seth has volunteered to help. We would ask the patient about olfactory nerve 1, which would be their sense of smell. If there's any changes or problems, we wouldn't necessarily assess that in office. And then for optic nerve 2, we would assess his visual acuity with the Snellen chart, which we're not going to use here. And then we would also do a fundoscopic exam and check his peripheral vision. So I'm going to have you look straight at my nose and tell me how many fingers I'm holding up.
2.
Perfect.
1.
Great.
2.
Great.
1.
Excellent. Okay, perfect. And then I would have you look over my shoulder, just at a point in the distance. And then I would dim the lights, but they're kind of far away. So hypothetically, I'm dimming the lights. I'm going to use my opposite eye to kind of open your eye here. Okay. Perfect. Okay, so I was just able to look and see the inside of the eye. The retina looks normal. The optic disc is intact and it's kind of a yellowish circle. And the vessels all look appropriate and are the appropriate 2 to 3 AV ratio. Awesome. So then we would test the oculomotor nerve 3, trochlear nerve 4, and abducens nerve 6 with some other eye exercises. So I'm going to have you follow my finger down, testing your extraocular movements. Perfect. So he was able to follow my finger easily. And then I'm also going to test your corneal light reflex. So just look straight ahead. Perfect. So the light shines equally in both eyes. And then I am going to cover one side and check your pupil response. Perfect. Okay, so his pupils are equal, round, and reactive to light and accommodation. And he also had an appropriate direct and consensual response when the light was shining in your eye. Awesome, so then we're gonna move on to trigeminal nerve 5. I'm gonna have you clench your jaw, and then I'm just gonna palpate here. I can feel that his muscles are engaged along the jaw, the masseter, and the temporal area. And then I'm gonna have you close your eyes and tell me if this is sharp or dull, okay?
Okay. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull.
Perfect, okay. So his motor and sensory function is intact for that nerve. After that, we would do facial nerve, which I believe is 7. Facial nerve 7, yes. Okay, so I'm gonna have you raise your eyebrows and then close your eyes real tight. Perfect, puff out your cheeks and then smile and frown and show us your teeth. Perfect, so his facial nerve is intact. That all looked good. Next, we would do auditory nerve 8 to test your gross hearing. I'm gonna have you plug this ear and just repeat what you heard on this side.
1, 2, 3.
Perfect, other side.
4, 5, 6.
Perfect, so his gross hearing is intact. After that, we would do hypoglossal nerve and vagus nerve. So I'm gonna just have you open your mouth and say ah. Perfect, and go ahead and swallow. Perfect, okay, so his uvula and soft palate moved symmetrically when he said ah, and his swallowing motion looked appropriate as well. Okay, so after those two, we would do spinal accessory nerve 11. So I'm gonna have you shrug your shoulders against resistance. Excellent, you can drop them. And then turn your hand against, or turn your face against my hand. Perfect, other side. Okay, perfect. So that is also intact. After that, we would do hypoglossal nerve 12. So I'm gonna have you stick out your tongue. Perfect, curl it up towards your nose, curl it down towards your chin, then go side to side. Perfect, and then I'm gonna have you push against my fingers with your tongue. Other side. Excellent, so there was no involuntary movements or twitching of the tongue. He was able to control it appropriately, and that all looked good. Awesome, so then we would do deep muscle, deep tendon reflexes. So I'm gonna have you relax this arm. I'm only gonna do it on one side, but we would be doing it on both sides. Just let this arm go limp. That would be triceps. And just relax this arm. Perfect. Biceps. This would be brachioradial. And we would come down here to patellar. Very nice. Okay, and then the Achilles tendon. Good. And then we would test the clonus reaction. Just forcefully plantar flex a couple times. If his foot were to bounce a little bit, a couple beats, that would be okay, but any more than that, any more than I think 3 beats would be a positive clonus test. Okay, so then after the deep tendon reflexes, we will do the motor function assessment. Okay, so I'm going to have you abduct your shoulders against resistance. Very good. Now other way for adduction. Excellent. Then I'll have you bring your elbows out. I'm going to have you flex your elbows against resistance. Perfect. And extend them. Great. Almost broke the chair. Okay, and then we'll do your wrists. I'm going to have you extend them up against resistance and down. Perfect. And then I'm going to have you just kind of lightly spread your fingers and then try and pull your fingers together and crunch my fingers. Very good. And stick your fingers together. I'm going to take these two, try and separate these two I'm holding. Okay. I'm going to try and separate these two I'm holding. Perfect. And then grip my fingers. Excellent. So he was able to do finger abduction and adduction against resistance, and also grip my fingers with equal strength. And then I will have you stand up to do the hips. So we're going to do hip flexion. Perfect. And then hip abduction on each side. Well, you gotta stay straight. Good job. And then adduction, coming back down like you did without the dog in your way. And then we would do knee flexion on each side. Perfect. And knee extension. And then plantar flexion and dorsiflexion on each side. Did you do it on each side?
Yeah.
Perfect. Okay. So then while you're still standing, we'll just have you walk around over there and back so that I can assess your gait. Perfect. Looks even. No problems there. And then would you walk back and forth, heel toe, heel toe?
Yep.
So we can see how your balance and coordination looks. Very good. Perfect. Okay. So you can, before you have a seat, actually, I'm going to have you close your eyes, put your knees and your feet together, and try and maintain your balance. If you were unable to maintain his balance after 30 seconds or so, that would be a positive Romberg test. Excellent. You can have a seat if she'll get out of your way. And then I skipped something with coordination. I'm going to have you rapidly turn your hands prone and supine. Very good. Perfect. You're coordinated, so that's good. Okay, and then we're going to test sensation on your hands and feet. So I'm going to have you close your eyes, turn your hands out, and tell me which hand I'm poking and if it's sharp or dull.
Sharp top of my right palm.
Perfect.
Dull side of my right hand.
Perfect.
Sharp left palm. Dull left palm.
Perfect.
Sharp left ring finger. Dull right middle finger.
Perfect. Okay. And then we'll test your feet. Socks would be off for this, hypothetically.
Sharp top of right foot.
Perfect.
Dull top of left foot.
Very good.
Dull left toe.
Okay.
Dull right toe.
Those were actually sharp, but your socks were on, so that would make sense. Okay. And then we would test vibration. So I'm going to have you hold out your hands. I'm going to test your feet and your hands. Tell me if it's just the normal sensation or if it's vibrating.
Okay.
Okay. And here, plug your ears actually. Thank you. Okay.
Vibrating.
Uh-huh.
Vibrating.
Uh-huh.
Not vibrating.
Okay. And I'm going to take your hands again.
Vibrating.
Very good.
Dull or not vibrating.
Perfect. Okay. And then keep your eyes closed. And tell me what I'm putting in your hands. You can feel it.
An Xbox controller.
Perfect. And then how about now?
A Lego.
Very good. Okay. So after that, I think we would do the meningeal signs. So for this, I would actually have you lay down.
Okay.
Oh, yeah. Okay, we're gonna have you flex your head. Any pain with that?
Nope.
Excellent. So that he's negative for nuchal rigidity. If he were to flex his head and have his knee flex at the same time involuntarily, that would be a positive Brudzinski's sign. And then if I were to have you just relax your head and then flex your leg up here, if that were painful, that would be a positive Kernig sign. The only thing I forgot, I'm gonna have you stand up again. Kimmy. You can have a seat. I forgot one thing in the coordination section, which is the finger to nose. So I'm gonna have you alternate between touching your nose and my finger, okay? Perfect. Excellent, okay. And then I'm gonna have you take your heel and run it along your shin on the other side. Perfect, switch sides, heel to shin. Okay, very good. And I think that's everything. Sorry about the interruption from our special guest. That should be good.